which used to be a French colony. So if you hear a resemblance of French in my accents, it has a result of that interaction. Having said that, I look at my journey um, in such a way that it's been a collage of experiences, or a buffet of experiences, if I may explain that. Let me unpack that for a minute. Um, I did work for the American Embassy, American Cultural Center when I was in the Ivory Coast, and I was an interpreter for people coming to do research in the country. And my goal was basically to educate them about the cultural implication of their research. For example, there was a situation where a researcher came, and the researcher was interested in looking at child mortality in the northern part of the country. And that was way back in 1982. So that gives you a sense of my little age. And so what happened that I had a program where I will now, today they call it cross-cultural communication. But back then for me, it was common sense. It was a program whereby if you wanted to do research in the country, I will have kind of to coach you as to understanding the cultural norms so that you can avoid the faux pas and move on with your research, right? So one day I got a call, and there was a researcher who was struggling in getting her research done. And so upon investigation, I drove to her location in the northern part of the country to realize that she had used a fabric, like a cloth, for her window. And that cloth in a particular region was basically considered something that prostitutes would use. Are you with me?
Yes.
So, or it looked like not necessarily prostitute, but it looks like it was kind of like an undergarment.
Mm-hmm.
So women will wear a cloth and a cloth and a cloth. There's a layer of clothing that goes on.
Yes.
Before a person goes out. It's just like it was wearing your underwear.
Mm-hmm.
So having a cloth that was extremely beautiful, but it was considered an undergarment for women. And women of attitude will just wear it as opposed to covering up. So that was rule number one. So I walk into the house, and there were two of us, American researcher and myself. And so my first reaction was, why did she choose this specific fabric to decorate her apartment? And why is that no one was participating in her research, especially women, given the fact that it was maternal health issue that she was dealing with? And it turned out that in the community, people look at her as a prostitute, that she was running a brothel, because the fabric that was outside through the windows were, what fabric that was considered women basically exposing women undergarment, right? And the second thing was also that a lot of men do go into her apartment more so than women. So two guys like me and my colleague walking into her apartment, for the community, it was like men going to have a good time. When the society was segregated by women and men, and interaction was kind of different. So in a nutshell, what I'm trying to get at was the fact that I never had the chance to interact with women, with researcher, to break it down for her as to how does a community function. Movement is important. Choosing a piece of clothing to decorate your apartment is important. If you don't know what you're choosing, you may send the wrong signal. So in order to solve the problem, I had to call my mother at the time, and I said, what's going on here? This is a situation that I'm dealing with. And she said, well, I think we need to introduce her to the women leaders in the community so she can start building the trust. And then eventually we need to take down those curtains, that resembles women's underwear. And then, so there were a lot of things that we needed to do, and we were able to do that. But I had to work with my mother.
Mm-hmm.
and my mother and I are very close still to these days. And the point I'm making is that it's important for us as public health practitioners. Now moving forward, I came to the U.S. with a Fulbright scholarship to do my degrees at Michigan State University, and then and eventually a PhD at University of Minnesota in UX design, UN Center, human factors, all those things, and then a master's in public health. But I was more focusing on pandemic and emergency preparedness. And my company does this work today, and we'll talk about it later. And so to sum up what you were saying earlier prior to this recording, is that we have a lot of work to do, and both from the country that are receiving us, and I say us as being educated in the West, and what's going on the ground. And as long as the country itself um, doesn't live up to its obligation to its people, there's not much we can do. It takes two to tango, because people have done this work before we came. And when you look at the reservoir of knowledge coming from women in those communities, I mean, it's equivalent even more than 25,000 PhDs coming from Yale or Harvard. They survive whatever you call it. They don't have the Mayo Clinic to deliver the babies or to do research. They raise us. Yes. And we are as gorgeous as we could be. You know what I'm saying? With the yam or the jerk chicken we ate, we are fabulous, right?
Yes.
So on a more serious note, I think we have a lot to do, and I've engaged in international research. I was in Nigeria during the Ebola crisis, and for me today, when I look at all this stuff, what's going on, I think that artificial intelligence and technology has a major, massive role to play. And I set up a company that is called EpiMap 24/7, and we're kind of in that space. How do we create a network of tools that allow community to engage the underserved? The good thing about technology today that almost everybody, has a cell phone. So the question is, how do we minimize interaction between those who are sick and the traditional model of having them to drag them behind to a clinic versus figure a way to reach them and having them geolocated and provide services so that it's very surgical and it saves life and time. So that's kind of what I've been, focusing on. On the other, another thing that I've done is I've been in airline industry for, almost 6 years looking at quality control. So I've been all over the place, but my passion is more, how do we, design a community-centered tools with them in mind, wherever they are, and then fill that gap to bring healthcare workers in a partnership where the trust is built and then the services are provided in such a way that there's a win-win situation, as opposed to, looking at a historical relationship with African American or African in the diaspora and mainstream culture, thinking of the Tuskegee experiment where people feared, where they actually broke the trust. And now how do we rebuild that trust? How do we, create an environment where I feel comfortable knowing that my data is safe?
Yes.
Knowing that people like us have been trained over the years to go back to our communities and say, you know what, this is a tool that I believe is basically doesn't reveal your personal identity, but it gives us a sense of doing some geo mapping of not only you but everybody in the community.
Yes.
And then how can we best work and mine that information so that we can be more proactive.
Now, is
so yeah, in a nutshell, I've been in this pandemic arena for almost 15 years, and that's my passion. All right, I talked too much. I'll stop here.
No, you haven't. Actually, it's quite refreshing, and So EpiMaps you mentioned is something that you developed.
Yeah.
Now, can it be used during this current pandemic of COVID-19?
You see, the thing that you and although I've done it for many years and I've developed many tools, there's always it's always political and it's always um, difficult to get minorities to position themselves so their creativity can be used. By that I mean you can have the best tool, but if you don't know the right person, they will never ever even look at it.
And that I
Even
think is a major barrier currently.
yeah, and that's my major barrier. Even when you present the technology to people, their first reaction is they look at your color, the color of your skin, and say, "Did you really do it? Who designed it?" When in fact I have a PhD in human-centered design and public health, the question always comes, how did you come up with those ideas? And so I've learned during the Ebola crisis after my experience in Nigeria,
Mm-hmm.
um, and that's where I started looking at artificial intelligence. That was way back um, in 2015. How do we maximize the data that we can get from our community and turn out our community into research centers so that the data that we collect on us can also be used within the community? And
Yes.
the tool that we develop we can train people to develop those tools and become researchers themselves, as opposed to always running to universities and so on and so forth. And as you can see, those ideas were not too cute. And so to this day, I'm still trying to figure out how to position myself to be heard as a little company
Mm-hmm.
or as a little researcher to say, have you looked at this tool? And the
Yes.
second thing is we don't have the machinery to have the finance to go after getting a patent. I tried once, I dropped close to 10 grand and it didn't work out, from the
Wow.
different project. But then you look at, the finance that goes around protecting yourself when you enter those arenas because you have a lot of sharks.
Yes.
We present our ideas, they say thank you very much, and they go do it.
Yes.
And that's been going on for so. But there's some hope. I'm
Well,
working
this
with some
goes back
folks
to
in the
health
Caribbean. And,
inequities. So this is the problem is with health inequities. There are because of the community you live in, because of the people you don't know, because of the color of your skin, you're being judged in that way. And in health inequities, it results in currently for the COVID-19 outbreak in those areas where they have more cases of COVID than in other places because of
mhm,
that prejudice, because of that health inequity. And so, if it is that, this is the thing that I found that should have been done, not only in the United States but all over, is for the governments to actually open up to the public and get these ideas from you all to help with these outbreaks, to help with these
mhm,
pandemics. If it is that during these periods in time, a holistic system solution involving public input, involving to hear ideas, because right now that's what we need. We need
that's what we need.
people. We need people like you. We need more ideas to help out as much as I can, but in an organized manner and
Mhm,
troubleshoot it in an organized manner. And that is not what is not happening. Currently, we're just dealing with cases that are happening or have happened and
yeah.
treating just cases. There's no system response to track them
No.
properly, and there's no system response. And when I say a system response, I don't mean like one university or one organization tracking them. There is no open source holistic unified front source by which
Mhm.
data is gathered on a national scale
Yeah. Yeah. Yeah.
and
And
to
yeah.
do proper research, to get proper samples to represent the population.
Mhm,
And the
mhm.
community and community members and educated professionals such as yourself is the people that we need to hear.
I think the what we've been missing for the longest time is the fact that our communities are very sophisticated. The knowledge um, that I find in our community always makes me humble. Feels like I should go back to school. The more I interact with people, the more. I give you an example. I was once in Jamaica. Like I said, I spent a lot of time in the Caribbean on working with the University of West Indies people in nephrology to build the first Caribbean renal registry. Uh, and so I spent a lot of time there and at the University of West Indies, right? And in other places. And I remember one incident where we were looking at diabetes, and there's always a notion of body mass index and so on and so forth. And there was one lady who, interrupted me in what I was doing. And she says, son, first of all, she called me son. She's not about Dr. Douah. I forget about your doctorate. You are my son, period. I'm like, okay, yes, ma'am. And she said, there are three questions that if you were to ask me, you and I will have such a wonderful time. All right. So I said, what are those questions, ma'am? And she said, if you ask me what makes me happy, when was the last time I was happy? And how do I go back to being happy again? Those three questions will open my heart. But you haven't asked those questions. You just focus on your data. You just focus on, I know I'm fat. And you know what? Most people here love fat women. I have a big booty. Everybody loves big booty. So your BMI bullshit doesn't work here because we love voluptuous women. Our men love voluptuous women. They don't have skinny women. So in my being fat, I have so many men who run after me. And I know it's not healthy for me, but this is a reality of our condition. We are people of African descent. We have big butt. We are voluptuous. Unfortunately, diabetes sneaks in and mess up with us. But your question should not be solely about my body mass index. It's about me as a person. What makes me happy? I was silent. To this day, and it's so emotional that I decided to write a blog. If you'll go onto my LinkedIn page, I wrote about this event and it transformed me. So I like to listen more and I always ask those questions. What makes you happy?